The absolute risk reduction will always look small for preventative medicine. I mean, heart attacks are rare in short trials.
Go and follow this doctor. She's amazing. She knows what she's doing. She's talking evidence-based medicine. So people want to argue absolute risk reduction versus relative risk reduction. These are people who say, well, if you put somebody on statins in these trials and the trials are like 2 years, 3 years, 5 years, you're not gonna have a trial for 80 years, which is what atherosclerosis is. But if you're on a statin trial, like the Jupiter trial for like 13 months, 14 months, and you had an absolute risk reduction of, 0.1, 0.8%, let's say 1%, but the relative risk reduction looks huge. It's 46% in the Jupiter trial, for example. That was only the absolute risk reduction over a 1 year span. It was 13 months. It was ended early because the results were so amazing. It was unethical to keep the placebo group on placebo because they were having an extensive amount of heart attacks and strokes, where the other group on the rosuvastatin in the Jupiter trial were not having heart attacks or strokes. So what happens is, over a long enough time horizon, the absolute risk reduction completely obliterates the relative risk reduction. If you have a absolute risk reduction of 1% and then carrying out over decades, people stay on rosuvastatin for decades, that absolute risk reduction is going to be ginormous. Obviously, the relative one goes up more, but carried out on a long enough time horizon, there's a huge difference, and that is what we're trying to explain to people. Yes, it might be a 0.8% this or a 1.2% that reduction, whereas the relative risk looks huge. It's like 33% reduction, 40% reduction, 80% reduction. Yeah, absolutely. That's how statistics works. When you're not versed in this and you're not a data scientist, it's very difficult to understand these things. But we are trying to explain it in a way that hopefully makes sense. That is what happens. And over a long enough time horizon, the absolute risk reduction. And then, so let's say you have a 1% reduction in death rates from MI if you're on statins. Now multiply that by 9 billion people on Earth. What does that end up being? You save, I don't know, 900,000 lives a year or 9 million, whatever it is. I don't know. I didn't do the math, but you save lots and lots of people over a long enough time horizon.